Okay, so acetylcholine will be synthesized with the help of choline and acetyl coenzyme. They serve as a precursors. Once the acetylcholine is synthesized, it will be taken up into the vesicles where it will be stored, isn't it? So whenever there is a stimulation of this cholinergic nervous system or parasympathetic nervous system, that acetylcholine will be released into the synapse, where it will go and bond to its respective receptors, will produce its functions. Okay, here as I told, some drugs they will interfere with this acetylcholine synthesis at different levels. Like there you can see visamicol. There you can see, so this is the visamicol. So this visamicol which will inhibit the uptaking of acetylcholine synthesizer in the exoplasm into the vesicles. So transportation of that synthesized acetylcholine into the vesicles, so that mechanism is prevented by the visamicol. So what happens when acetylcholine is when it is not taken up into the vesicles, its level in the axon terminal will be depleted, because this acetylcholine, if it is not taken up into the vesicles, so gradually it will be leaked out into the synapse, and where it will be degraded by the cholinesterase enzyme. So that's why always acetylcholine will be stored in the vesicles. Not only acetylcholine, all neurotransmitters will be stored in the vesicles. Okay, here also same, it will be stored in the vesicles, but that storage of acetylcholine will be prevented by the visamicol. Okay, so likewise here you can see botulinum toxin. So this toxin which will prevent the release of a acetylcholine, even though cholinergic nervous system is stimulated or parasympathetic nervous system is stimulated, but it is unable to release acetylcholine into the synapse. What happens if acetylcholine is not released into the synapse? It will not produce any effect. Even though parasympathetic nervous system is stimulated, it won't produce its effect, because acetylcholine not at all released into the synapse. So when it is not released, so it will not act on the receptors, so there is no effect. Okay, so likewise another drug, hemicolinium. So this hemicolinium which will inhibit the choline carriers. As I told now in last class, acetylcholine, once it is released into the synapse, where degrading enzyme is there, acetylcholinesterase or cholinesterase, where which will rapidly convert acetylcholine or rapidly degrade or metabolize acetylcholine to choline and acetate. Once that choline is formed from the acetylcholine, again it will be taken back into the same nerve endings through the choline carriers. It is an active process through which the choline will be taken up into the same nerve ending. Again it will be used for the synthesis of another molecule of acetylcholine. So it will be recirculated. Choline is a precursor which will be recirculated. But what this hemicolinium will do, the hemicolinium which will inhibit this carrier protein, choline carrier protein. So what happens when it is inhibited? So there is no reuptaking of this choline. So when it is not recirculated, so there will be a deficiency of choline for the synthesis of acetylcholine. Ultimately, eventually that will affect the synthesis of acetylcholine. So thereby the acetylcholine level will be depleted in the cholinergic nerve endings. Okay, and another class of drugs, drugs which will block the effect of acetylcholine to the receptors, like non-depolarizing blockers and depolarizing blockers. So these drugs will block the acetylcholine actions at the receptor level. Okay. Okay, next drug, pilocarpine. So pilocarpine is grouped under cholinergic alkaloids, which stimulate only the muscarinic receptors. Pilocarpine which will only acts on the muscarinic receptors, especially at the eye. So that's why this pilocarpine is used in ophthalmology for the test. Okay, which is mainly used in the chronic simple glaucoma, as well as acute congestive glaucoma, and as well as a myotic. So which is only used in those conditions, since it will act only on the muscarinic receptors, especially at the eye. Okay, next another important class for your exam point, anticholinesterase agents. Anticholinesterase. As I told earlier, anticholinesterase drugs are the drugs which will inhibit the enzyme acetylcholinesterase or cholinesterase. So because of that, there will not be any degradation of acetylcholine. So in this synapse, acetylcholine level will be increased by these drugs. So ultimately, acetylcholine level will be increased. So that will causes the increased binding of acetylcholine to its receptor, respective receptors, where it will continue to produce its effect. Okay. So these anticholinesterase drugs, they are classified into two classes: irreversible inhibitors and reversible inhibitors. Irreversible inhibitors, as I told earlier, irreversible inhibitors will inhibit the enzyme permanently. So there is no regaining back of the enzyme activity. Once it is inhibited, that enzyme activity will be inhibited permanently. So it is not reversible. Whereas reversible inhibitors will inhibit the enzyme for a shorter period of time. Yes, all of you there?
Yes, sir.
Okay, good. Okay, so reversible inhibitors will inhibit the enzyme only for a shorter period of time, say 20 minutes or 30 minutes, depending upon the type of drug which will act on that enzyme. So after a specific period of time, the enzyme activity will be regained. So that's why those drugs are grouped under reversible inhibitors. Okay, irreversible, again, inhibitors, they are again divided into two classes: insecticides and nerve gas poisons. Insecticides like organophosphorus compounds like parathion, malathion, diazinon, icathophate, and nerve gas poisons like soman, sarin, and tabun. Reversible inhibitors, based upon the duration of action, they are classified into short acting drugs and medium acting drugs. Short acting like adrophonium, medium acting drugs like neostigmine, festigmine, pyridostigmine, and tacrin. So in an exam, in 2 marks or in 5 marks, they may ask classification of these anticholinesterase drugs, or they may ask write a short note on neostigmine, physostigmine, pyridostigmine, okay, parathion, malathion, icathophate. In 2 marks they may ask. Okay. First I will tell you how acetylcholine will be degraded by the enzyme, cholinesterase enzyme. Now, can you see this image? Hello? Can you see this image? Hello? Okay, so this image that depicts how acetylcholine been metabolized by cholinesterase enzyme. There you can see. So this is the cholinesterase enzyme. Okay, so this is the cholinesterase enzyme, which contains two sites, esteretic site and anionic site, where this is the catalytic site of the cholinesterase enzyme, to which the acetylcholine will bound. There you can see. So this is the acetylcholine. There you can see this is the acetylcholine. So when acetylcholine bound to this cholinesterase enzyme, there you can see now this acetylcholine has bound to the, here you can see this is the acetylcholine which is occupied on the cholinesterase enzyme. Afterwards, acetylcholine will be degraded by the cholinesterase enzyme. Here you can see. Here you can see acetylcholine will be degraded into choline and acetate. Once this enzyme becomes free, there you can see choline will be released from the acetylcholine. Okay. Once this enzyme becomes free, now it will attack another molecule of acetylcholine. Again, it will metabolize the acetylcholine. So likewise, it will continues. So that's how the cholinesterase enzyme that will degrade or metabolize the acetylcholine. So because of this degrading enzyme, effects of acetylcholine will be reduced. Okay, so these inhibitors, enzyme inhibitors, cholinesterase enzyme inhibitors, there are two types, as I told, reversible and irreversible inhibitors. So reversible inhibitors, here also same. These drugs also will bound to the same enzyme like neostigmine, pyridostigmine, physostigmine. These reversible inhibitors, once they get bound to the enzyme, so that catalytic side of the enzyme will be blocked by these inhibitors. So now that enzyme is not free. Since the enzyme is not free, so that acetylcholine cannot bond. As I told earlier, acetylcholine will be bonding to the enzyme only if it is free. But because of the reversible inhibitors, this acetylcholine cannot bound to the catalytic site of the enzyme because it has been already bound by the reversible inhibitors. Now it is not free. So once that reversible inhibitors bound to the enzyme, uh, it will remain in this enzyme for a shorter period of time. That again depends upon the type of drug, whether it is a short acting drug or medium acting drug. Based upon that, this enzyme will be blocked for a specific period of time, say 20 minutes or 30 minutes, minimum 20 to 30 minutes, the enzyme will be blocked. So till then, the 20 to 30 minutes, that enzyme is not available for the metabolism of acetylcholine, isn't it? So up to that 20 to 30 minutes, the enzyme is unable to metabolize acetylcholine. So the 20 to 30 minutes, the acetylcholine continue to increase its level, so continue to act on the cholinergic receptors where it will produce its effect. Okay, so what happens after the 20 to 30 minutes? So after the 20 to 30 minutes, even that enzyme will metabolize or degrade or catalyze that drug also. Here you can see. So even that drug is also metabolized by the enzyme. Now after the 20-30 minutes, once that drug which is bound to the enzyme, once it is catalyzed or hydrolyzed or metabolized by the enzyme, now the enzyme will be free. Now you can see, now the enzyme is free. Once that enzyme is free, now it can attack acetylcholine. Till then, acetylcholine continue to act on the receptors. So once it is free, once that enzyme is free, it will attack the acetylcholine. Now it will degrade the or metabolize the acetylcholine. Okay, so that's why these drugs, they are called as reversible inhibitors. Why? Because they will inhibit the enzyme only for a shorter period of time. After that specific period of time, the enzyme activity will be regained. But irreversible inhibitors, as the name indicates, irreversible inhibitors, they will inhibit the enzyme irreversibly. Once the enzyme is inhibited, it will be inhibited permanently. There is no regaining back of the enzyme activity. Why that enzyme is inhibited permanently here? Because it will form a phosphorylation reaction with the catalytic set of the enzyme. Here you can see it is a covalent bond formation between these irreversible inhibitors and with the catalytic site of the enzyme. You know that covalent bond is the strongest bond. It cannot be hydrolyzed easily. But here, hydrogenic bond. In case of reversible inhibitors, it will be a hydrogenic bond. But here, it is a covalent bond. It is the strongest bond of all bonds. So because of that, there is no regaining back of the enzymes. So enzyme will be inhibited permanently. So what happens when enzyme is inhibited permanently? So there will be a continuous increase in the acetylcholine level at the synapse. So when its level continuously increased at the synapse, it continuously will act on the receptors, which will produce the long lasting effect, isn't it? It will continuously acts on cholinergic receptors, so it will continuously produces the cholinergic actions. So at some stage, it will produce the poisoning effects, because acetylcholine will continuously act on the receptor, will produce the poisoning effect, or will produce the excessive pharmacological effect. So that's why we will see the excessive pharmacological effects in case of insecticide poisoning. You know that insecticides are nothing but organophosphates. So these irreversible inhibitors, nothing but organophosphate compounds. So which is being used by the farmers for the those crops. So those insecticides, how they will produce poisoning effect? Because they will inhibit this enzyme permanently. Because of that, there will be excessive pharmacological effect of acetylcholine. That's why the poisoning symptoms are, poisoning patients will show symptoms like salivation, bronchospasm, okay, pinpoint pupil, increased weakness. So all those are the excessive pharmacological effect of acetylcholine. Okay, are you there?
Yes, sir.
Okay, good.
Yes, sir.
Okay, so important anticholinesterase drugs like physostigmine and neostigmine. So physostigmine, which is a natural occurring alkaloid, and which is a tertiary amine, and which having a good oral viability, and which is having a CNS action, and which is used in treatment of glaucoma as well as antidote in the atropine poisoning. Whereas neostigmine, it is a synthetic drug, and which is a quaternary amine compound as compared to the first stigma, which is a tertiary amine. Okay, neostigmine, which is having a poor oral absorption and which is also which is not having any CNS action unlike physostigmine, and which mainly acts on the skeletal muscle. Neostigmine, which is mainly acting on the skeletal muscle. So that's why which is used in treatment of myasthenia gravis. You know that myasthenia gravis is a muscular disorder where this neostigmine is used, and it is also used in the urinary retention cases. Okay, last point, important point in this cholinergic drugs uses. Okay, these drugs are used in open or wide angle glaucoma cases, since these drugs facilitates the uh, draining of the excess aqueous humor, so which helps in the bring out that intraocular tension to the normal level. So that's why these drugs are used in the treatment of glaucoma, and these drugs are also used as a myotic, especially pilocarpine in refraction testing, and in myasthenia gravis like neostigmine, which is mainly used in treatment of myasthenia gravis, and retention of urine like neostigmine, which is used in treatment of retention of urine, since which will causes the widening of the bladder, or which will facilitate the micturition process. So that's why these drugs are used in treatment of retention of urine as well, and these drugs are also used in the treatment of drug poisoning cases like atropine poisoning or tricyclic antidepressant poisoning, since these are the agonist and atropine is antagonist, tricyclic antidepressant which is also antagonist. So if the patient is having a poisoning of atropine or tricyclic antidepressants, so such poisoning cases can be treated with the these cholinergic drugs, since these are the agonists, especially the cholinergic agonists, they are mainly used where these drugs will replace that antagonist from the receptors, cholinergic receptors. So thereby those poisoning effects of those antagonists will be prevented by these agonists. Okay, in Alzheimer's disease also these drugs are used, especially the donepezil, galantamine, rivastigmine, tacrins. So these drugs are used in treatment of Alzheimer's disease. Okay, so that completes the cholinergic drugs. Okay, any doubt?
No, sir.
Okay, so in this class we have discussed definition of cholinergic drugs, classification of cholinergic drugs, and pharmacology of cholinergic drugs. Okay, so definition, as I told, these drugs which will facilitates the actions where which mimics the functions of a parasympathetic nervous system. So that's why they are called as parasympathetic, parasympathomimetic, cholinergic, as well as cholinergic or cholinomimetic drugs. Okay, and the classification, they are classified into two class, cholinergic agonist as well as anticholinesterase drugs. Okay, pharmacology, that already is, as I told, which will act on the various types of receptor which are located at various organs or systems, will produce the effect of those receptors. Okay. Okay, so that completes the cholinergic drugs.